This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Have you covered the difference between adenomyosis and endometriosis?
So endometriosis is where the cells of the lining of the womb end up outside the uterus, attaching themselves and burying themselves into the linings covering the back of the uterus, the ovaries, the bowel nearby in the pelvis, and causing quite significant pain and potentially infertility. The other condition that often goes along with that endometriosis issue is called adenomyosis. And that's where those cells don't go outside of the uterus. They actually get buried and grow inside the muscle of the uterus. The symptoms of women with adenomyosis are not dissimilar to endometriosis in that, as you could imagine, these cells, which are responding to the female hormone cycle, which grow during a normal menstrual cycle. As the estrogen rises leading up to ovulation, the lining of the womb grows, and any cells like those cells, which the adenomyosis is, also grow. And then when the hormones decline, if pregnancy hasn't occurred, those cells break down. And those cells breaking down cause some bleeding, inflammation, and as a result of that, period pain can be significantly increased. The adenomyosis is diagnosed almost universally by ultrasound by a well-trained sonographer in one of these women's health ultrasound practices. They're the ones that do it best. And once the diagnosis is made, it is actually a difficult problem to deal with. How much it impacts in infertility is still widely debated. Minor or even moderate amounts of adenomyosis in the uterus probably don't make much difference. They certainly cause pain in terms of symptoms, but in terms of fertility probably don't make a great deal of difference. The severe cases, occupying a substantial part of the muscle of the uterus, would appear to impact on the possibility of carrying a pregnancy. The options for treatment are tricky. Surgical removal is virtually, well, it's possible, but you're damaging the whole uterus in doing so, cutting out a whole segment of the muscle, and therefore the uterus may be useless afterwards in terms of being able to successfully carry a pregnancy. What we generally try and do, if we're concerned that it's a major infertility problem, is try and suppress those cells with medical treatment. There are compounds that switch off the menstrual cycle. The simple contraceptive pill may be helpful in dealing with symptoms. It doesn't seem to have much impact on actually resolving adenomyosis. The other options are to create a menopausal state. In other words, to switch off all the estrogen. This can be done by injections that switch off the pituitary gland for 3, 6, 9 months. And during that time, the cells, we hope, degenerate like the lining of the womb gets thin. In that scenario, we hope that the cells inside the muscle of the uterus also resolve. That treatment has a downside, however, in that the menopausal symptoms, hot flushes in particular, can be significant, and many women are unhappy to carry on with treatment because of those symptoms. But it is a trade-off. If you want to improve the situation, you may have to put up with that. The newer endometriosis drugs are yet to be shown to have an impact on adenomyosis. They should, but they're early days in relation to those medications. So adenomyosis, diagnosed with ultrasound, associated with painful periods in particular, when severe, associated with fertility problems, but overall, it is still a relatively uncommon situation compared with endometriosis itself, probably only affecting 2 or 3% of all women.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.